subscribe to my YouTube channel Meditate Literature Mandala and also hit the press bell icon whenever I upload my video get notified.
Good morning everyone. The topic is Norma Frontalis. Norma Frontalis is the view of the skull that is seen from the front. Anteriorly what we see in the skull is the Norma Frontalis. Talking about shape, it is roughly oval in outline. It is wider above than below. That is roughly oval in shape. Then the presenting features of this view are the frontal region, that is the uppermost part. Frontal region, it is formed by the frontal bone. Then below the frontal region there are two orbital openings. Below the orbital openings in the medial plane lies pyriform aperture of the nose. Lateral to it are the prominences of the cheek, which are formed by zygomatic bone, and then comes the lower part of the face, which is formed by maxilla and mandible. So frontal region is there, which is formed by frontal bone. Then we have the orbital openings and the pyriform aperture of the nose, prominences of the cheek as we go more lateral, and then lower part of the face, which is formed by the maxilla and the mandible. Now, if we talk about anatomical position of the skull, then a plane known as Frankfurt's horizontal plane is very important. Now, what is Frankfurt's plane? Frankfurt's plane is a horizontal plane that passes through the infraorbital margin and the superior border of external acoustic meatus. So, horizontal plane which passes through the infraorbital margin and the superior border of external acoustic meatus is known as Frankfurt's plane. So when we talk about the anatomical position of the skull, the orbits should be facing forward and the skull should be placed in a way that the infraorbital margin of the orbit and the superior border of external acoustic meatus lies in the same horizontal plane, that is the Frankfurt's plane. This is the anatomical position of the skull. In this image you can see the bones that forms or that can be seen from the front view or in Norma Frontalis. So in this view we can see the uppermost part is formed by the frontal bone, which is in blue color. This bone forms the forehead. Then below that in the median plane you can see two orange colored bones. These are the nasal bones. These form the bridge of the nose. Then below that the green colored bone are the maxillae, right and left maxilla. These forms the upper jaw. Lateral to the maxilla lies zygomatic bone that forms the cheek prominence, and below that in the lowest part of the face lies the mandible, which forms the lower jaw. Another image where you can clearly see the bones colored in differently colored. So superior most is the frontal bone, that is blue colored. Below that is the orange colored bone, which is nasal bone. Below that is the maxilla, and lowest one is the mandible. Lateral to maxilla you can see zygomatic bones. Now these bones articulate with each other at sutures. So there are various sutures that can be seen in this view. So the different sutures that we can see in this view in Norma Frontalis are: the first one is the frontonasal suture. As the name suggests, it is between the frontal bone and the nasal bone. As you can see, the first marking or the first labeling in the picture, that is the frontonasal suture between the frontal bone and the nasal bone. Second is the frontomaxillary suture, that is between the blue colored frontal bone and the green colored maxillary bone, that is the frontomaxillary suture. Then the two nasal bones also articulate with each other anteriorly through internasal suture. So the suture between two nasal bones is internasal suture. Nasal bone also articulates with maxilla, as you can see posteriorly. So the suture between the green colored maxilla and the orange colored nasal bone is the nasomaxillary suture. Below the pyriform aperture, if you see the two maxillary bone, these articulate with each other at intermaxillary suture, that is the intermaxillary, between the two maxilla. Then zygomatic bone also articulates with two other bones, that is the frontal bone, as you can see, in its upper part, and maxilla in its medial part. So the suture where the zygomatic bone articulates with the frontal bone is the zygomatico-frontal suture, and the suture where the zygomatic bone, the orange colored zygomatic bone, articulates with the green colored maxilla is the zygomatico-maxillary suture. So these are the sutures that are seen in Norma Frontalis. Coming to the different regions of the Norma Frontalis, the region which lies in the uppermost part is the frontal region. So this frontal region shows some structures, out of which one is superciliary arch. Superciliary arches are the rounded, curved elevations, as you can see in the diagram. It is shaded in green color. These are the rounded, curved elevations just above the medial part of each orbit. These linear elevations are known as superciliary arches. These are more marked in males as compared to females. The next structure is glabella. Glabella is a median elevation. Glabella connects two superciliary arches. It is seen in the median plane. It is a median elevation connecting two superciliary arches. The third structure is nasion. Nasion is a meeting point, median point at the root of the nose. Here two sutures meet. One is the internasal suture and the other is the frontonasal suture. So it is a point where internasal and frontonasal sutures meet. This is nasion. Another structure is frontal tuber or frontal eminence. It is a low rounded elevation. It lies above superciliary arches on each side. It is more prominent in females and in children as compared to superciliary arches, which are more prominent in males. This frontal tuber is more prominent in females and in children. Now the second region is orbital openings. Orbital openings, as you can see in the image, these are quadrangular in shape, four-sided figure. They are quadrangular. So they have got four margins. Superiorly, it has got supraorbital margin. Inferiorly, it has got infraorbital margin. Medially, it has got medial margin, and laterally, it has got lateral margin. So supraorbital margin or the upper margin is formed entirely by the frontal bone. As you can see, it is formed entirely by the blue colored frontal bone. At the junction of the lateral 2/3 and medial 1/3 of the supraorbital margin, there is a notch or a foramen known as supraorbital notch or supraorbital foramen. The nerves and vessels of the same name pass through this structure. Infraorbital margin, as you can see, it is formed by two bones. Laterally, you can see it is formed by the orange colored zygomatic bone. Medially, it is formed by the violet colored maxilla. Medial orbital margin, this is also formed by two bones. In its upper part, it is formed by frontal bone, and in its lower part it is formed by maxilla. It is ill-defined as compared to other margins of the orbit. The lateral orbital margin, it is formed by frontal bone above and zygomatic bone below. So that was orbit. Next structure is anterior bony aperture of the nose, also known as piriform aperture. So superiorly, as you can see in the image, it is bounded by nasal bones, and inferiorly it is bounded by maxilla. Inferiorly, it has got nasal notch, which is formed by the body of the maxilla. Articulations of the nasal bone, as you can see, the violet colored nasal bone in the image, superiorly it articulates with the frontal bone. So the suture between them is known as frontonasal suture. Then inferiorly, it has got attachment of a cartilage. Anteriorly, they articulate with each other at internasal suture, whereas posteriorly, it articulates with the maxilla through nasomaxillary suture. So these are the articulations of the nasal bone and the names of the sutures. Coming to the lower part of the face, it has got maxilla and mandible. So maxilla, it contributes large share in the formation of facial skeleton. As you can see, it is covering most of the area of the facial skeleton. So there are different processes of maxilla that are seen from this view. The three processes that are seen from this view are the frontal process, that is directed upwards, zygomatic process, that is directed laterally, and alveolar process, that is directed inferiorly. Frontal process, as it is directed upwards, it articulates with the frontal bone at frontomaxillary suture, also with the nasal bone through nasomaxillary suture. Zygomatic process is directed laterally and it articulates with the zygomatic bone through zygomatico-maxillary suture. And the lower process, process that is directed downwards, is the alveolar process that bears sockets for upper teeth. There are different structures that can be seen in maxilla. One is the nasal notch. This can be seen medially. The two nasal notches meet in the midline, forming the nasal notch. The nasal notch can be seen medially. It forms the lower boundary of the pyriform aperture. Then there is anterior nasal spine. Anterior nasal spine is where the two nasal notches meet in the median plane. Then there is infraorbital foramen. As we go laterally, infraorbital foramen lies 1 centimeter below the infraorbital margin, and it allows the passage of infraorbital nerves and vessels. The next structure is canine eminence. As you can see marked on the left side, canine eminence is formed due to the root of the canine. That elevated portion is known as canine eminence. Now there is a depression behind this canine eminence as well as anterior to this canine eminence. So the depression anterior to this canine eminence is known as incisive fossa. It lies above the incisor teeth. It is known as incisive fossa. And the depression posterior to this canine eminence is known as canine fossa. So these are the parts that are seen on maxilla. The next bone is zygomatic bone. It is also known as malar bone. It forms the prominence of the cheek. Again, two processes of this bone can be seen in this view. One which is directed upwards, that is the frontal process. The other is directed medially, that is the maxillary process. So frontal process of zygomatic bone articulates superiorly with the frontal bone at frontozygomatic suture. And the maxillary process of zygomatic bone medially articulates with the maxilla and zygomatico-maxillary suture. On the lateral surface of this zygomatic bone lies zygomaticofacial foramen that allows the passage of zygomaticofacial nerve. So this is about zygomatic bone that is seen in Norma Frontalis. The next bone is the mandible, that is the lowermost bone. It forms the lower jaw. It bears teeth in the alveolar arch or in its upper border. So these are the different bones and the structures that are seen in Norma Frontalis. Coming to the last part, that is the clinical anatomy. In this, one thing is that the nasal bone is one of the most commonly fractured bones of the face. It is the bone that gets most commonly fractured. That bone is nasal bone. Second are Leaford fractures. Leaford fractures are actually mid-face fractures. These are bilateral. These are of three types, as you can see in the image. Leaford type 1, Leaford type 2, and Leaford type 3. What happens in Leaford type 1? It is a horizontal fracture. In this, the fracture line, as you can see in the first image, the fracture line passes through the root of the nose. It runs actually along the floor of the nose. Sorry, it doesn't pass through the root of the nose. It runs along the floor of the nose above, and it is parallel to the palates, and it runs below the zygomatic bone. So in type 1, the fracture line passes or runs along the floor of the nose. It is parallel to the palates, and it lies below the zygomatic bone. In Leaford type 2, this type of fracture is pyramidal shape. In this, the fracture line passes through the root of the nose, floor of the orbit, and then it runs medial to and below the zygomatic bone towards the alveolar margin. Again, this also runs below the zygomatic bone. In Leaford type 3 fracture, the fracture line runs through the root of the nose, superior orbital fissure. It's a fissure inside the orbit. Superior orbital fissure and lateral walls of the orbit above the zygomatic bone. So here the fracture line passes along the root of the nose, superior orbital fissure and lateral walls of the orbit above the zygomatic bone. In this type, that is Leaford type 3 fracture, there is complete separation of cranial skeleton from the facial skeleton. So these are the 3 Leaford fractures, and the fracture line passes through different regions. In type 1 and type 2, the fracture line passes below the zygomatic bone, whereas in type 3, the fracture line passes above the zygomatic bone. So this is all about Norma Frontalis. Thank you.